Hello, welcome everyone. My name is Father Zach Swantek. I'm the chaplain at the Aquinas Institute, and I want to welcome you for our monthly guest lecturer. And this month, we're very excited to have Dr. Monique Ruberu, who will be speaking to us on the gift of fertility. I think this is so important, especially with the work that we do with the students, and especially the work that I do with with couples as they prepare for marriage. We do a lot of the theology behind that, but then also we want to introduce them to other people who can witness to living out their faith in their professions, and also living out their faith from the perspective of the experts, and in this case, from a doctor's expertise that can help the couples, especially with that desire for children and with fertility, and to really recognize what a great gift this is. And so Dr. Ruberu is a certified OBGYN and Creighton Fertility Medical Consultant, and I'll let her speak more about that, but we welcome you. Thank you.
Thank you. All right, let's start as we should start all things in prayer. In the name of the Father, Son, Holy Spirit, amen. Lord Jesus, we thank you so much for this opportunity. I thank you for every person who has shown up today and for all of those who are tuning in via live stream as well. Lord, I ask that you completely empty me at this moment, that you fill me with your Holy Spirit, that you surround this room with your guardian angels, and that you open the hearts, the minds, the ears of every person who hears this message, Lord. I ask that you plant deep seeds deep into their hearts, deep into their minds, and that you move them not only to consider everything that I offer in this talk, but also to have the strength, to have the courage to stand up for the truth at all times in this life, that they may be willing to undergo any sort of persecution in order to just be truthful and to live the truth and the gift that you have given them in their lives, to maximize that. Lord Jesus, I ask this all in your name. Our Lady, we ask that you bless each and every one of them. Hail Mary, full of grace, the Lord is with thee. Blessed art thou amongst women, and blessed is the fruit of thy womb, Jesus. Holy Mary, Mother of God, pray for us sinners, now and at the hour of our death. Amen. Father, Son, and Holy Spirit. Good evening, everyone. So, as I said, I'm so happy to be here. Normally, I do not speak from the podium. Normally, I do not read off of a script. But as I wrote this, I was initially writing it just to have some points to talk to you guys about. I always ask God in prayer, what should I say? But as it came out, I was like, oh my gosh, I don't want to mess up any of this. It came out really well, and I feel like it's exactly what he wants you guys to hear. So excuse me for using this today, but I felt like it was really important. So thank you so much for being here today. I am so honored to stand before you guys to talk about something that's been a cornerstone of my life's work, the gift of fertility. It's a gift woven into the fabric of humanity, a sacred ability to co-create life, to bring forth new souls into this world. At its heart is conception, a moment so profound that it defies explanation, yet demands our reverence. For the next hour, I want to take you on a journey through this miracle. Why it's worth celebrating, why it's worth protecting, and how we can honor it in a culture that too often dims its light. This isn't just a topic for me, it's extremely personal. As a holistic gynecologist, I've spent years walking alongside women through their triumphs and their struggles with fertility. I've seen the tears of loss, the joy of new life, the frustration of dismissed symptoms. Every single day in my office, I'm reminded that fertility isn't just a medical concept. It's a gift that reflects our deepest humanity. It shaped who I am, and it's why I'm here. To share what I've learned and to call us back to a truth that we've strayed from, that every single life, from its very beginning, is a treasure worth fighting for. So let's start with that beginning, conception itself. I'd like you all to just take a moment and close your eyes and imagine this. A single sperm, one of millions, embarks on an incredible journey. It navigates vast, intricate landscapes, the fallopian tube, a space that's both delicate and resilient, pulsing with life. It's propelled by a whip-like tail, driven by a singular purpose. Ahead lies the egg, an absolute marvel in itself, released from the ovary in a quiet burst of possibility, cradled by tiny finger-like projections that guide it forward. Then, in a fleeting, miraculous instant, the sperm meets the egg. The membranes touch, fuse, dissolve, and a spark ignites. In that moment, a new human life begins. A unique genetic code, unlike any before or after that has ever been written. Picture it unfolding. Within hours, that single cell divides first into 2, then into 4, then into 8. Each split is a silent symphony of growth. By day 3, its tiny cluster, a morula, is the name for in Latin for mulberry, soft and round. By day 5, it's a blastocyst, a fluid-filled sphere with an inner cell mass destined to become a child. You, me, everyone here. This isn't just a process, it's poetry. It's the universe folding in on itself to create something brand new. A sperm and an egg, each carrying half of a story, unite to write a novel. One with chapters of laughter, tears, dreams, all scripted in that first breathtaking union. It's not just biology. It's a whisper of the divine. This is the beauty of conception. A dance of life choreographed with precision and wonder. It's why I stand here, convinced beyond a doubt that life begins at that very moment. Every beating heart in this room started right there. In that sacred spark, how could we call it anything less than a gift? A treasure so exquisite that it demands that we pause, reflect, and protect it with absolutely everything that we have. But as you all know, this gift is under threat, not just in fleeting moments, but in the very way that we approach fertility. So let's talk about abortion first. It's a really heavy topic, and I don't use it lightly, but I do talk about it all the time. Some people argue that it's a necessary option. But I can absolutely tell you, as a physician, abortion is never medically necessary. They consider it to be a solution to poverty, unplanned pregnancies, and medical emergencies. I've heard claims from other physicians that it's absolutely needed, and I completely disagree. I've sat with women who are facing those fears at those moments. I've felt their desperation. I've seen the pressures that they walk through. But I'm here to tell you that we don't need it. Abortion is never necessary, not even in the most high-risk pregnancies. Let me explain. So when a patient has a pregnancy and it's considered high risk, for example, she has large fibroid, she has a heart condition, she has high blood pressure, she has a cancer diagnosis. There's actually a particular type of physician, an OBGYN who has subspecialized even further, called a maternal medicine, fetal medicine physician. And this physician's job is purely to manage high-risk pregnancies. So So their job is to walk through the pregnancy with this patient, to consult alongside her delivering doctors, and to be able to assess the safety at that moment of the mother and the child, to consider each of them as an individual patient. And at any point along the way where the risk is too severe, that physician has the option. They can suggest to them, this is no longer safe, you should have an abortion. Or they can suggest to them, this is no longer safe, you should deliver early. The difference with an early delivery is that this mother may still end up having a cesarean delivery with a scar on her belly and everything else, but her infant, her child, I shouldn't say infant, not that far along in the pregnancy, but her child will not be ripped piece by piece apart, will not be thrown into the medical waste. Rather, her child will be delivered, wrapped in a blanket. If the child is old enough to actually survive, then the child will be given medical care to try and prolong its life. But if the child is pre-viable and can't survive, that family can hold the child, take pictures of the child, mourn the child, spend its last moments with the child, and then ultimately bury the child. It's so different. It's an opportunity to respect and honor and love. And I've had so many patients who have chosen this even in the face of knowing that their child would not survive. They would rather allow that child to be honored rather than allow somebody to go in and dismember their child and throw it away. And I have a few examples of this that are just so beautiful. I had a patient she was a patient of mine for a long time, and she had actually moved to Africa. She had gotten married over there. And then she reached out to me, just probably about 7-8 months ago. And she said, Dr. Ruberu, I'm in Africa, but I have these really large fibroids and I'm pregnant. And all the physicians here are telling me that I have to have an abortion. And I said, sweetheart, you never have to have an abortion. There's got to be another way. And she said, they're telling me that because of the large size of these fibroids, if I carry to term, I'm definitely going to die. And that even if I survive, my baby will be born with so many disabilities because the fibroid is pressing against the baby and it won't be able to grow properly and it's going to have all these issues. And I said, does your baby have a heartbeat? And she said, yes. And I said, where there is a heartbeat, there is hope. And she said, Dr. Ruberu, I'm going to get on a plane and I'm coming back to Philadelphia. So she literally got on a plane and came back to Philadelphia just because she wanted the support of a physician who would actually stand in her court and be by her side to walk her through this. And unfortunately, I refused the COVID vaccine, so I don't have surgical privileges. So I couldn't do her surgery or be in her operating room. But I was able to talk to her and support her, and she was able to come into my office and talk to me. And when she came to visit, she was extremely uncomfortable. She had humongous fibroids in her uterus. And the father of the baby basically said, I want you to have an abortion because nobody in my family has any disabilities, and I don't want a child with disabilities. And I said, let's pray for your husband that he comes around. And I was like, let's just pray that God will work this all out so that you and your baby can be safe. And she walked forward and she insisted. She went to the maternal fetal medicine doctors and she advocated for herself. And she said, I am not choosing abortion. So what else can you offer me? And they worked with her and they monitored her pregnancy and they took her right up to 37 weeks. And then they planned a C-section and they had everything that they needed in advance of that surgery because they knew what they were facing. They knew that she would likely need a blood transfusion. They knew that there's a possibility they would have to do a hysterectomy. They knew all of that going in. And they knew that because they knew her case well and they were good doctors. And so she went for the surgery and sure enough, she had a lot of bleeding and she did have to receive blood during the case. And then following the surgery, she had to have a slightly prolonged stay in the hospital. But then a month later, she sent me the most beautiful pictures of her gorgeous little boy snuggling up against her. And she was like, Dr. Ruberu, I would never have done anything different. She was like, even if I died in the process, this child is so worth it. He is so amazing and so beautiful, and he is going to live in this world. And his contribution, his life was worth fighting for. And I was just so moved, this little guy was so close to death. He had a death sentence from everybody that had heard of him in Africa. And so I feel like that's kind of an extreme case. Then there was, some of you might have actually heard this. This is a young girl that I know who I think is an absolute hero. She was a young mother. She and her boyfriend had an unplanned pregnancy. She was going to university, and she was happy to have conceived, though. Her family was okay. They weren't pressuring her to abort or anything like that. They were a pro-life family. And they were in a car ride, and she got in an accident. And because of the accident, she got really concerned about the baby, and she decided to go to the emergency room. When she went to the emergency room, they did an ultrasound, and through the ultrasound, they found out that the baby had anencephaly. So anencephaly means that a portion of the baby's skull was missing. And so the prognosis for the baby was very poor, that the baby would absolutely live as long as it was inside of her, but then after birth, it may not live very long at all. So every physician that she encountered from that point on tried to convince her that she should have an abortion. And the very first time that she went in and spoke to the physician, they just wrote down anencephaly on a piece of paper. They gave it to her and they said, don't Google it. This is what your child has. I don't know anybody who hasn't chosen abortion, and I suggest that you do the same. And her mother straight away, luckily she was too shocked to say anything, but her mother said, absolutely not. We're a pro-life family. We are never aborting this child. And so then the doctors really didn't know what to say or do because they had never managed a baby that had anencephaly. So they said, well, I guess we'll just keep monitoring you then. And they monitored her all the way up to 39 weeks and 2 days. And this patient decided that since they knew this child would not be able to have a long life outside of her belly, they were going to celebrate everything that she ever wanted to do with this child if it had lived to 100 years. And so they went apple picking and they went to the shore, and she did everything that she ever thought that she would do with her child growing up in Philly. Like, people would offer them all these like crazy trips, like, oh, you should go to Disneyland and you should do this and you should do that. And she was like, no, I just want to do the stuff that we would have done with him if he was here and he was a little kid. Because I want to be able to do those same things with his future siblings, and so that when we do them, we can say, oh yeah, we also did this with Shane. And Shane went apple picking, just like we're taking you guys apple picking. And Shane went to the shore, just like we took you guys to the shore. And we celebrated all of Shane's birthdays in advance, all that sort of stuff. And she made a beautiful book about this, and they made a website and they put it on the website, and that went viral. And so I heard about this story years ago when I first became a pro-life OBGYN, and I've been talking to people about this story. And then recently I did a podcast debate, and she saw it, and she saw that I was speaking about her son, and she reached out to me. So it was so beautiful. I finally got to meet her and talk to her about everything. And it was just so, so lovely. But she is also just a perfect example of somebody that is told straight off the bat, this is a medical emergency. You need to have an abortion. You should not carry this child. You should save the child of the trauma and save yourself of the trauma. But in reality, yes, it's traumatic to lose your child at any point. But it's way more traumatic if you're the one who is making the decision to end the life of your child. Then you have to walk with that for the rest of your life. And it's not an easy one to walk with, sadly. The last one that I wanted to talk to you about was another patient. So, well, let's move on from the high risk. Oh, well, actually, no, I wanted to mention this one as well. So I don't know if you guys realize, one of the diagnoses that physicians often will tell people that they need to have an abortion for is Down syndrome. There are some countries in the world where they brag that they have actually eliminated Down syndrome. And all that means is that every single Down syndrome child has been aborted, because you can't eliminate Down syndrome. You never know who is going to have Down syndrome. And so 90+% of Down syndrome people are aborted. There is no medical emergency associated with carrying a Down syndrome child. Even in the case of trisomy 18, which is a far more severe genetic abnormality, there are like definite, obvious features that those children have. Their lifespan can be much shorter. Instantly, when somebody is given a diagnosis of trisomy 18, they're told that they should abort. And the perfect example of that is Senator Santorum's child, who has trisomy 18. And when they were diagnosed with this in the middle of the pregnancy, and they were told to abort, and they refused, and then she was born, and yes, they have walked through multiple medical emergencies with her, but when she's gone to the hospital, there have been so many instances where physicians have just been shocked because they've never encountered a child with trisomy 18, because they were told that those children can't survive. And here she is, not just surviving, but thriving. And if you talk to her siblings, they would say that she is the most important person in their household. She is the individual that helps them to realize that every single day is precious. She is the individual that helps them to access and understand what true joy is. The love of family, the love of communication, the love of just being around those that you love. And it's not the money, it's not the things that we have, the possessions, but rather those moments of connection. Every single family that I know that has a child with some sort of a disability, it actually turns out that that is more of an ability than we have. Just because somebody is given a diagnosis and they're different from us, it doesn't mean that their life should be ended, right? Every single one of us are flawed in one way or another. We don't have perfect eyesight. We don't have perfect hearing. We may have diabetes or high cholesterol or a sweet tooth that gets us into lots of trouble. There's like so many issues. We might not be very good at sports. We might not be very good at public speaking. We might not be able to get along with other people. Those are all differences. But it doesn't mean that any life is less worthy of supporting and protecting and honoring. That child with Down syndrome, that 99% of its people are gone, is the one person who sits next to the grumpy aunt or uncle at Thanksgiving and can get a smile out of them. That's the one person that when you're in a household and everybody's kind of falling apart, that's the one person that brings the joy every day. It's just amazing to me how easily people are willing to just throw away those lives because of a medical difference. So, as I said, these cases and countless others prove that abortion isn't a medical necessity. It's a choice that we reject. With skilled MFM care, with courage, with compassion, we can protect both lives, the mom and the baby. Since 1973, over 60 million lives have been lost to abortion in the US, a generation absolutely silenced. But we can offer prenatal care that saves, communities that provide resources, adoption pathways that open doors. These aren't dreams, they're commitments that we can fulfill now. Let's widen our lens a little bit. So fertility itself. The capacity to conceive is under siege as well, not just through abortion, but through how we treat fertility. We suppress it with contraception, we bypass it with IVF, we dismiss its struggles. Contraception, for example, is sold as freedom, but it's actually just Band-Aid medicine. Would you ever think of taping up a leaking pipe and assuming that that would work? Well, that's basically what you're doing with contraception. Every time that a physician gives somebody contraception to address painful periods or irregular cycles or abnormal bleeding or mood disorders or anything else, polycystic ovarian syndrome, all they're doing is putting a Band-Aid on top of it in order to try and cover up symptoms. I am a doctor who strives to practice root cause medicine. So the idea of Band-Aid medicine drives me absolutely nuts. I can't stand it. And that was how I was trained. I was trained allopathically in a typical medical school and a typical residency, and that was all that I was taught. Every single problem was either take it to surgery or put a contraceptive on it. And it was so boring. And it doesn't shock me at all that there are so many gynecologists that after working for years and studying and paying all sorts of high fees for schooling and being in debt will completely back out of medicine because they are so burnt out and they're so tired of what they do, because there's very little mental thought that has to go into it. And there's a lot of just burnout having to do with boredom as well. Every day when I was practicing as a typical gynecologist, it was just, you see these 30 to 50 patients, and every single one you're seeing for about 5 minutes, and oh, you have abnormal bleeding? Here, try this contraceptive. Oh, you've got pain? Okay, try this contraceptive. Oh, you've got this? Let's try this contraceptive. Oh, that one didn't work for you and now you have side effects? Okay, let's try this contraceptive. And it was just about shoveling more and more contraceptives down their throats. But thanks be to God, at this point, I don't practice that way anymore. And it's all about listening to the patient, understanding what's actually going on, doing the proper investigation, and then treating the root cause rather than using a contraceptive to hide all of the issues. And contraceptives aren't something that doesn't have any side effects. As we all know, it can cause worsening emotional symptoms. It can cause you to have an increased risk of cancer. It can cause you to have extreme estrogen dominance, which stays on after the time that you're on the contraceptives. So any issue that you're covering up with a contraceptive, the minute that you get off of it, that issue is still there and it's probably worse. So I see women every day who have been told that their bodies are problems that have to be managed. I listen to their stories, their fears, their symptoms, their hopes. I dig into their bleeding patterns, their pain, their cycles. I order lab work and studies, not just the basics, but I want to know the full picture. And I want to uncover exactly what's going on. Then we make every effort to try and heal it. There are a couple of stories I have associated with this as well. So there was this one patient, and she was diagnosed with PCOS. And for most typical gynecologists, the only treatment for PCOS is to put someone on birth control pills and to help them to have regular cycles through that. They're not true regular cycles. They're kind of fake bleeds that are happening at a certain time based on the pill pack. Her doctor, for many, many years, told her that because she had PCOS and it was so severe, her only chance at fertility was if she could have regular periods. Because if she wasn't having periods, then she wasn't ovulating. and then there's no chance for fertility. So she put her on a birth control pill. And I'm sure all of you, even though you're not physicians, you can understand that using a birth control pill does not quite even out to trying to have a baby, right? That makes sense? For some reason, this doctor, either it slipped through the cracks or she didn't realize that herself, and she continued her on this birth control for years and years and years. Every month, this girl was trying to conceive, thinking that she could possibly conceive, being on the birth control, and that her only chance having PCOS in order to conceive a child would be to stay on this because that will give her periods, and that would mean that she has a chance at fertility. She came to me in her 40s after doing this for many years. And I straight away got her off of the birth control pill, and we started using progesterone to help her cycle, to try and help her to have normal cycles. And then we started giving her medication to try and help her to stimulate ovulation. And she was actually ovulating, and she did have a chance at fertility at that point. But she had wasted so much time that it was so much harder for her at that point in her life. Similarly, in traditional allopathic medicine, if you are to have a miscarriage, the first time that you have a miscarriage, you're typically told, you know, it happens a lot. There's absolutely nothing to do. We don't know why this happens. It's just bad luck. Try again. So I had this beautiful patient, and she tried. The first time she miscarried, she was really upset. She went back. That was the story they told her. She conceived again, super excited, miscarried again, went back to the physician, and they were like, oh, I'm really sorry, but yeah, this is probably just a fluke again. There's really nothing much that we can do because traditional gynecologists don't check any labs regarding recurrent miscarriage until you've had 3 losses. So 2 really doesn't make that much of a difference. So then she got pregnant again, and she had a 3rd loss. And this time they said, oh, now you're a recurrent miscarriage patient, and there must be something wrong, so let's check your labs. And that checking of labs means that they're just going to check whether or not she has like a clotting disorder. Or they'll check her thyroid, but they'll check a very minimal thyroid workup. And the range for their thyroid labs is very wide, so it only picks up those that have extreme thyroid dysfunction, not those that have a smaller amount of thyroid dysfunction. And they were like, all of your labs are fine. There's nothing wrong. So just keep going. Thank God somebody told her about our office, and she came into the office. Within the first 5 minutes of talking to her, I already had 3 things that I thought were likely wrong with her. One was just talking about her bleeding patterns. She had cycles which were only 26 days. Now, a normal gynecologist will tell you that normal cycles vary from 24 to 35 days, and in my mind, that's completely ridiculous. And I think the reason that they say this is because we're never taught in residency how to manage abnormal periods. Everything is really managed with birth control. So they don't go deep into why it's shorter or why it's longer and what you can do about it. So a true normal cycle is 27 to 29 days. If it's less than 27 days, it means something. If it's longer than 29 days, it means something. So this girl's cycles were longer than 29 days. It turned out that she actually had mild polycystic ovarian syndrome. She had a mild thyroid dysfunction. She had a dysfunction with the MTHFR gene, which she had a mild clotting disorder with that. So we just addressed all of those issues. Because of the PCOS, she had low progesterone after ovulation. So there's no way she could sustain a pregnancy because she wasn't ovulating well enough and she didn't have enough progesterone to sustain the pregnancy. So we gave her progesterone at the right times. We had her start using a baby aspirin. We had her use methylated folate. We had her address her thyroid issue. And then, lo and behold, when she conceived for the 4th time, we monitored her pregnancy all the way through, checking her progesterone levels every single week and adjusting her doses as the weeks went by. And she delivered the most beautiful girl named Faith. And I was, thank God, the next day, because this was after the COVID debacle, so I was able to go and visit her, and I got to hold Faith, and that was just such a gift for me. And then, following that, she had another pregnancy, and now Faith has a little brother. So it's just such a beautiful thing, and it's so sad when I hear over and over the terms unexplained infertility or recurrent miscarriage without a cause, because I know that that's all a complete lie. The truth is that our fertility is such a gift. And there are things that go wrong simply because we live in a society where we're taught that we can basically do whatever, eat whatever, drink whatever, not sleep, undergo tons of stress, and expect that our bodies function at an optimal level regardless. But the truth is, our bodies need rest, our bodies need peace, our bodies need nutrients, our bodies need to be able to have enough water so that we can stay hydrated and our body can function properly. There are so many small things that we can be doing to help our bodies function properly. But if we disregard and we don't attend to our bodies and our fertility, then naturally it's going to disintegrate. It's not going to be available for you when you want it to be there, correct? So all of these patients, they're just beautiful women who have experienced some very challenging things, but luckily they found their way to the right place. And they were able to be treated in a beautiful way. Most women that have very heavy bleeding have no idea that they even have very heavy bleeding, because they think that their bleeding is normal because that's exactly how their mother bled, or their sister bleeds, or their cousin bleeds. So the idea of what is truly normal has kind of gone out the window with this whole idea of my normal, your normal. No, there's one normal. And either you're within it or you're not. And understanding what that normal is super helpful so that you can actually evaluate your own fertility, your own cycles. The other thing which I find is really interesting is when a patient is diagnosed with a fertility challenge and they go to an IVF doctor, naturally, the IVF doctor, their job is to promote IVF, right? Do any of you guys know how much it costs to have a single IVF cycle? Ballpark. Who wants to take a guess? Yep.
100,000.
Not for a single cycle. That would be way more. But a single cycle is anywhere between $7,000 to $10,000. 1 month, trying for 1 month. So many people undergo a lot of financial hardships, putting their house into mortgage, taking extra loans, dipping into their savings just to fund IVF treatments. But what exactly is IVF? Like, what happens in the midst of IVF, and why is that an issue for life and for respect of life? So in IVF, the first thing that they do is they hand the guy a bunch of pornography, send him to a room, and have him masturbate so that he can create a specimen. Then they wash that specimen down, collect those sperm. For the woman, they put her on multiple drugs to be able to kind of hyperstimulate, to create more eggs that are available so that they can go in and they can extract as many as possible. So then they put the sperm and the egg together and they create embryos. And from what we spoke of before, you guys all know that life begins at conception. So each and every one of those embryos are children. Those are those people's children. And each of those embryos are graded. And so they all have different levels of grading. And the ones that are better are preserved, and the ones that are of poorer quality are instantly thrown away. So this couple that is paying so much money to have one child is now throwing away several of their embryos, right? When they do IVF, they can only place 2 embryos in the uterus at one time. So say this lady ends up with 6 viable embryos, 8 viable embryos. So 2 are put into her uterus, and those 2 are considered the fresh cycle. Every other embryo is then taken and stored in cryo, and those embryos now she is locked in so that she has to pay to keep them in cryo every month. It's basically like she's paying the babysitter. The 2 that were placed into her uterus, either they will die, or one will live and one will die, or they'll both survive, or they'll do really, really well, and they'll take off like gangbusters, and they'll split into a triplet pregnancy or a quadruplet pregnancy. When that happens, the doctors go on high alert. And they say, oh, now you have a very high-risk pregnancy. And if you continue with this quadruplet pregnancy or this triplet pregnancy, you have a very good chance that your children will have mental dysfunction, learning disorders, they'll deliver prematurely, some of them may die. So we suggest that you just reduce. Reduce is a really pretty word for abort. So these babies all at this stage have a heartbeat. And so they choose which ones they're going to stick a needle into and stop their heartbeat. And so yes, this is absolutely abortion in the midst of this IVF care. Does it happen for every single IVF patient? Thanks be to God, no. But it happens more than enough to be able to speak on it and to know that this is true, that it definitely happens. So then this woman will go on and hopefully carry those babies to term. But now she has all these other embryos that are in the freezer. And she is either locked in to do this cycle over and over and over, or at some point she'll just get tired of paying and she'll say, hey, you can give them up for adoption. And so those babies go into the vast number of babies that are up for embryo adoption, snowflake adoptions. Or she'll just say, just stop freezing them and let them thaw. And then those ones die as well. So as you can tell, the process of IVF comes with so many moral and ethical issues. And so the counterpart to that, like what else can you do? You're dealing with challenging circumstances, you're having difficulty conceiving. So what we do in our office, in Napro Technology, trained physicians and other physicians who work with root cause medicine, is we look and find out, why are you having fertility problems? And by analyzing their cycles, by identifying where they're ovulating, then we can check labs at the exact correct time so that we can actually understand what's going on. We can tell if somebody has inadequate progesterone. We can tell if somebody has an infection inside of their uterus that needs to be treated. We can tell if somebody has estrogen dominance that's causing them to form polyps and fibroids that are getting in the way of a pregnancy. And then we also don't forget the father, because the father is 50% of the fertility. So typically when a man goes into an IVF clinic, there's no question about what is your medical history, have you had any surgeries, yada, yada, yada. All of the information is purely from the mother. They might talk to the husband, they might get a semen analysis, but even when they look at the semen analysis, they're analyzing it in terms of IVF, not in terms of natural conception. So if a man has very low numbers when it comes to the ability of the sperm to swim, or the number that are actually normal in appearance without 2 heads and 2 tails, or the quantity of sperm, they're looking for the minimal numbers because they're going to handpick those sperm and put them in a petri dish. But with natural fertility, we need numbers that are way higher. So many men out there are being told, your semen analysis is perfect. And when I see them in my office, I'm like, sorry to tell you, buddy, but your semen analysis is not perfect, and you should be taking these vitamins to superpower your sperm so that you can increase your fertility. And yes, you need a thyroid workup, and yes, you need to check and see if you have diabetes, and yes, you need to stop drinking coffee, and yes, you need to stop smoking marijuana, and yes, you need to stop sitting on the car heater, and yes, you need to stop doing HIIT training, and all of these things that none of that is being addressed. So basically 50% of the fertility is being ignored, and it makes sense because for an IVF doctor, you get paid by doing IVF. If you're going to address all those issues and solve them, you're not going to take as many patients to have IVF done. And you're not going to get paid in the same way. So why would you do it? When you can do a cursory, introductory, little bit of a workup and have people feel like you're doing what you need to do. But that being said, I'm not saying those doctors are horrible people by any means. It's a breakdown in the system. It's a system that's training us to do what we're doing, that teaches us how to respond to patients and what questions to ask. And unfortunately, because our systems are based on medications that cover up symptoms, nobody is being taught to look for the root cause of anything. You go to any physician pretty much who's trained allopathically, and all we're trained to do from medical school up is to look at, oh, you have this symptom, how can I make that feel better for you? Not why is that symptom happening, or what is the root cause of that symptom, or what can you do differently to avoid the underlying issue which is bringing about this symptom. So the doctors that are there are likely beautiful people who are trying their best to serve people in the best way that they know how. But once you're in a system like that, it's very difficult to step out because we're also trained with a lot of fear that if you go against the grain and if you do something different, you're likely to get sued. And none of them wants to do that. So it is what it is. But thanks be to God, there are other options for people, and they don't have to stick with the traditional options. So like I was saying, IVF costs $7,000 to $10,000 per cycle. You could even find some cycles, I'm sure, that they're charging way more, including all the medications and whatnot. But Napro Technology, I could honestly say if a person in 1 month does every test that we offer and they have to pay out of pocket because they don't have insurance, they would probably pay no more than $1,000 to do every test that we could possibly do. It's just, the cost differential is so crazy, but also the fact that when we're trying to help people to conceive with Napro Technology, typically they will only conceive one child. And so I do have a couple of babies that have been twins, but it's never been more than twins. And those pregnancies are so much less risky. They're so much safer for the mom and for the baby. And going forward, the mother knows what medical issues she has and she can address it each time. And in between the pregnancies, she can actually address those same issues so that she's not dealing with the other symptoms that have to do with that particular problem. For instance, everything is so tied together. So if somebody has shortened cycles, tail and brown bleeding, and PMS symptoms, meaning that right before her period she'll have headaches, anger, irritability, sadness, breast tenderness, all of those things are tied together. They're all signs of low progesterone. And so if you address the low progesterone issue, not only will your PMS symptoms get better, not only will you have longer cycles so that you're not becoming anemic because you're bleeding so frequently, not only will you be a much more pleasant person to hang around, so your marriage will actually be better maybe, but it's just that you're not covering this up with contraceptives and then having to deal with it later. People with low progesterone also have, like I mentioned, a risk of recurrent miscarriage, postpartum depression. And you can eliminate all of that just by understanding the underlying issue and addressing it. It's crazy. It's crazy that we were never taught these things, but I'm really glad that we know them now. All right. So I guess I deviated from this quite a bit, but nonetheless. I just wanted to share with all of you guys that, number one, every single life is precious, from conception all the way to natural death. At every opportunity that we have, we as Christians, we as members of the human race should be willing to stand up and to defend life. And it's going to come at you from all ends, right? There will be people who are promoting abortion. There will be people who are promoting, contraceptive care. There are people who will be promoting euthanasia. There will be people who are promoting all sorts of ideas. And it's never a popular stance to go against what society is saying. It takes a lot of bravery. It takes a lot of willingness to stand up in a crowd and disagree and have the risk of people possibly not liking you. But it is so worthwhile, because at the end of the night, you can go to sleep knowing that you spoke truth. And at the end of the day, the only opinion that matters is God's opinion of you. Nobody else's opinion matters, because the last person who has a say on whether you go to heaven or you go to purgatory for a prolonged period of time or you go to hell is God, right? So spend your whole life trying to please him and forget about what anybody else thinks. If somebody takes issue with the fact that you are standing up for life, praying outside of an abortion center, offering resources to women who need it the most, that's their issue. That's not yours. And every time that we encounter people who have differing thoughts from us, our job isn't to come up against them and to shout at them or to make them feel small or anything like that. Because the only thing that changes minds and hearts is love. And so you're far better off when you encounter individuals that are coming up against you and trying to, tell you that you're wrong or you're stupid because you're trying to defend life. You're far better off trying to befriend them, trying to find commonalities with them so that you can actually have a conversation rather than a shouting match. And then try and congratulate them as much as possible in the midst of the conversation so that they're more interested in having that conversation with you without ever lying or stepping back from the truth, but still trying to pursue like a civil conversation. I think we'll get a lot farther in life if we can do that. And I guarantee you, there has never been a moment that somebody has chosen life or somebody has chosen to honor their fertility or somebody has chosen to go against the grain that I've encountered where I've had any regret whatsoever. No matter how much persecution that I've walked through for standing up for my beliefs, for refusing certain things, for stepping away from opportunities, just to be able to say that I followed God and I followed the truth, it always works out. And it works out so beautifully because God honors that. So if you guys have any questions, I'm happy to answer. If not, that's all I've got. Yeah, go ahead.
Thank you so much for coming. I was just wondering, we keep hearing that there's these rising infertility rates, and I was wondering, what do you think, is the root cause of that? What are the things why today in this age are there such rising infertility rates?
Absolutely. So if you look around, right, we live in the most polluted society of our time. Almost every food that's in the grocery stores has some sort of color or preservative. Very few people are eating whole foods that are cooked at home. with like natural ingredients. Most often it's out of a can or it's from a fast food joint. It might not be organic, so there's pesticides that are put on these things. Even the meat that we're eating, if we're eating out at a restaurant, it's likely animals that have been fed all sorts of soy and all sorts of chemicals in order to bulk them up and give them like the greatest opportunity of making money in the sale. And so there's a lot of things that we're putting into our bodies that impact how our bodies function, right? That being said, God created our bodies perfectly. And He has every bit of knowledge about where He has us and what we're walking through in life. And so He created our bodies to be able to have mechanisms to fight all of these things. He gave us an amazing liver whose job is simply to go around and get all of the toxins and package them up and put them into the gut and get them out of our system through the gut. But 9 times out of 10, most people are not drinking adequate amounts of water. And even if they are drinking adequate amounts of water, they chase it with caffeine. And even the smallest amount of caffeine will act as a diuretic, and then you're left in this dehydrated state. So when you're dehydrated, your body is looking for water, and you've already drunk all the water you're going to drink for the day. So now it's like, where can I get water? Start sucking it back from your gut. What's in the gut? All the toxins that your liver has packaged up and put into your gut to get out of your system. So many people that I treat are in this cycle of continually sucking back all of these toxins. So their body becomes totally inflamed. They have so much inflammation in their body. Their joints hurt, they have swelling, they have brain fog, their cycles are off, their thyroid's not functioning well, and then they're so busy. They don't have a moment to rest because they feel like they can't get anything done, so they're staying up late. So now they're not even sleeping, or they have problems sleeping because of the level of toxicity in their body, right? So all of those things can be remedied. All it takes is having an understanding of how our bodies function and the fact that every single thing we put into our bodies makes a difference. Right? So if somebody has toxicity in their body, what can they do? They can cleanse their body. They can change what they put into their body. They can drink water. They can eat organic food. If they can't afford organic food, at least they can eat like fruits and vegetables that may not be organic. It's still better than, the stuff that's covered with all of the colors and the preservatives and everything else, right? They can go for walks. They can go to sleep. They can have cold showers. They can do breathing exercises. There's so many things that somebody can do to help their body to cleanse. When you do that, so many of these issues will start to remedy themselves. Like, you realize that in our bodies, there isn't a single organ that is the exact same organ that you had when you were born, because all of the cells are continually dying and regrowing. So as we expose our bodies to good, healthy nutrition, eating fruits and vegetables and getting all the vitamins that we need, then our bodies actually get the building blocks that they need in order to heal. Does that make sense? So much of infertility also, I believe, is because of this issue with gynecology. Because of the issue that you go to the doctor, number one, your problems aren't even identified as problems, right? So you go in there and you're bleeding heavily and nobody is saying anything about heavy bleeding. You go in there and you are bleeding heavily and they finally realize it and they send you for an ultrasound, but they don't send you for an ultrasound at the right time of the cycle. So then when you go to the ultrasound and you get the ultrasound back, the radiologist reads it as completely normal, even though it's actually abnormal. And so things just don't get addressed properly. And so then they just keep snowballing and snowballing. And finally, like, all the physician knows to do is like, okay, if this is bothering you, just take a contraceptive. And so you take that contraceptive and you feel better because now you're not bleeding as much, or now your pain is better. But then you reach the point where you finally met the person you want to spend the rest of your life with. You want to have a baby, so you get off of contraception. And then what happens? all of those underlying issues are still there, if not worse, because you've never addressed them. So now you're having to spend years trying to backtrack and trying to address these issues. But nobody except a root cause medicine doctor will understand how to even begin to treat those things without cutting up your uterus or putting you on some other pharmaceutical. Make sense? Yeah. Anybody else with questions? Yeah, go ahead.
First, thank you very much for the presentation. I'd just like to ask a question on your review about the distinction between abortion and delivery of a non-viable fetus. And excuse me if I misunderstood something about either the procedures or your position on them, but it would seem to me, as I'm trying to think through it, that in both cases the physician is doing something that they know will result with absolute or fairly near certainty in the death of the fetus. So is there a distinction between the two that you could elaborate on between sort of the respect for the physical form of a fetus?
Absolutely. So when somebody is told that they have a life-threatening illness, typically what they're offered is you should have an abortion. And what that means in most cases is we should take you to the operating room, give you anesthesia, we should go in with a Sofer clamp and literally rip leg by leg, arm by arm, your baby to pieces, and then put it back together, and then it goes in the trash, right? So that's how the abortion happens. What I'm saying is if you reach the point in a pregnancy where the mother's life is absolutely at risk, rather than aborting that child, you deliver that child early. Yes, it is a possibility that that child will pass, but you are not directly harming that child. You are delivering the child, but you're not intentionally killing the child. And that's a big difference. Does that make sense? So in delivering early, you're leaving the possibility that as medical advances happen, as God's miraculous nature exists, that there is always the possibility that that child may have a chance at survival. Even if that child was to pass early, it passes in a surrounding of love, of respect. There was never a moment where that child was thrown away, where that child was disrespected. If you leave that child in place, both the mother and the child could die. But you're attempting to at least save the mother's life, and you're trying to honor that child as much as possible. Does that make sense? Okay. Yes?
Hi, thanks again. I'm sorry my voice is a little hoarse.
You're fine.
Have you ever had a case where you felt that the situation was too great that the mother could not deliver early? It was too urgent? Has that ever happened?
No. Because if you're in a case where the mother is bleeding out, what is the solution? It's to deliver the baby. And you can deliver the baby in that situation the same way that going to the operating room and dismembering a baby doesn't take any less time than just delivering the baby. You know what I mean? Yes.
You touched a little bit on IVF, and I've encountered a situation with someone who recently had a closer encounter with Christ. She had baby through IVF and has 2 frozen embryos. What is the moral predicament there? What happens there? What's the situation?
It is so challenging, but the thing is now she's kind of locked in, right? So I've had this conversation with so many different priests. Morally, ethically, what is the right thing to do? You've already been participating with IVF. You already have these embryos. And it comes into this kind of split decision. There are some moral ethicists that will say those embryos were created in such a situation that it's better to just let them go, rather than the woman engaging in IVF over and over and then being in the position where she's told that she has to, possibly have more abortions or whatever. There are other medical ethicists, bioethicists that would say, no, obviously those embryos are now in existence and we have to try and honor their lives every opportunity that we can. So allowing them to go through the embryo adoption where somebody else who is infertile, who has no access to IVF, can then use those embryos and try and allow them life. I don't know. I'll only know when I hopefully one day get to heaven. Ask Jesus. But it's such a challenging one. I kind of feel like my gut is, you've already created those embryos. They're your children. So it's kind of your responsibility to take care of them. And yeah, you're probably going to be out a ton of money. And if you do end up with triplet pregnancies, you should carry the pregnancy through, but give them the opportunity for life. Yes?
Is there a way that a family can use IVF to have children while respecting the dignity of life, like by not freezing any embryos, by not discarding any, by just implanting embryos?
So the thing is, if you don't freeze the embryos, like you could say, okay, we're going to go through this round of IVF, but we're only going to allow you to create, we're only going to allow you to take out 2 eggs so that we can only create 2 embryos. And if those embryos survive, then we will only place those 2 embryos into the uterus. So there aren't any babies to freeze or any embryos to freeze. I suppose somebody could do that. I have never heard of that being done, simply because of the price tag that's associated with IVF. When somebody's having to pay that much money, they're assuming that half of those embryos are going to die just because they won't be good enough quality, and so they want to hedge their bets. So I've never heard of anybody who has tried to do that. I have heard of places where they will, like in our office, when a patient has to do a semen analysis, we have a special kit that they purchase, and they perform they're intimate with one another at home, and then they collect the sample in that way using a perforated condom. So that eliminates at least the pornography and the masturbation and all of that sort of stuff, which is great. And I have heard of IVF centers that have done that for couples that insist upon it. But say they place those 2 embryos in the uterus and now they're there with a quadruplet pregnancy. There are couples who have refused to engage in reduction, and then they have the quads. And thanks be to God, I mean, I know a few quad families that have happened that way. So I guess, yeah, there's a way to maneuver the system, but why would you want to when there's another option that is way cheaper, way safer? Oftentimes babies that are conceived through IVF actually have slightly higher risks for cancer and for anomalies because of all the manipulation that happens with the eggs and the embryos. So the reason I think most people choose it is because not enough people know that Napro technology exists. And so the only option that they're given is IVF.
Thank you.
Yeah. Yes.
So just to touch on what you said about how people knowing about Napro technology, most of my Catholic friends know about it, but a lot of my friends outside of Catholic circles, when I say it, they're like, what are you talking about?
Right.
Is there any effort on behalf, like by Napro doctors or like a Napro association to help get the word out, more so people know about it?
I mean, the thing is, from what I've seen, a lot of the Napro associations and stuff, when they're showing up at different events, they're showing up at Catholic events, right? So they're not going to like infertility conferences that are completely secular and trying to promote what they're doing. I think Dr. Hilgers, who started Napro Technology, when he would go back to like the American College of Obstetricians and Gynecology and try and speak of these things, they'd laugh him out of the room. So I think he got tired of being disrespected and he kind of slowed down. But the generations of past, you know, maybe they are doing stuff. Personally, I am like in the middle of writing a book so that I could, you know, spread the word about what I do and how I treat patients. And I'm going to start my podcast, so then that will be out there sharing stories of, you know, root cause medicine and what we do through Natural Women's Health. So yeah, I mean, I feel like people are talking about it, and the more that you step out into the natural community, the majority of my patients are coming to me willing, like even if they don't have the insurance that we accept in the office, they're willing to sacrifice just so that they can be seen by a physician who understands that there's more to this that needs to be found. And likewise, I mean, I think every integrative physician that's out there, every person who's kind of working in that more holistic space, they're all doing similar work. So it's not just us with Napro Technology. There's dietitians that do root cause medicine. There's so many people who play into this fertility space that may not be sanctioned by the Catholic Church, but they're also doing really good work. So when I made my exit kind of from traditional allopathic medicine and I cracked that door open, then I started realizing like there was all this information that I had never been taught as a typical gynecologist. And that really just opened my mind and my eyes to, gosh, like what else is there? What have I not been taught? What do I need to learn? So every day is like I spend at least 30 minutes reading, you know, about vitamins and about biochemical pathways and ways to address different issues, because there's so much available and so much that we just were not taught in medical school. So hopefully that'll change over time, but.
Hi there. The root cause approach to fertility definitely seems like common sense to me at least.
Doesn't it? Yeah.
But I really have to ask, what percentage of couples that come into your practice or across the movement, you know, are going through the treatment, through all of the consultations, and then what percentage are leaving with a healthy child?
Oh gosh, it's actually quite high. Yeah, so Napro Technology, they've actually collected numbers through the Pope Paul VI Institute, and they have a much higher success rate than IVF. The IVF success rate is about 20 to 30%, and for Napro Technology, it's more like 60 to 80. So if you can find the root cause and address it, not only do you increase your chances of having a successful pregnancy, but also just the opportunity to address the underlying issues that will radically change your life and your ability to just live a healthy life. And yeah, it's one of those things that unfortunately people don't know about this, but the success rates are really high. And even for the people that don't have a successful pregnancy, there's so much closure in after being told for years and years that you have unexplained infertility. That's the worst thing in the world you could ever hear. Like, I can't conceive a pregnancy, but I have no reason for not being able to conceive a pregnancy. Once you actually have an understanding of what's going on and what the barriers are, even if you can't conceive a pregnancy through your own belly, there is so much peace in having that understanding of what is going on and that you're not crazy. And then you can move forward and open every other door and window. If you have the desire to expand your family, there's so many other ways that God can build your family, right? So I always talk about adoption and foster as not failures, but those are actually major successes. You're taking a child that wouldn't otherwise have a beautiful home, and you're providing them with a beautiful family that wants to love them and accept them and raise them. And so I don't think that's a failure at all. I think that's a gift. So. Yep. Did you have a question, or you're just playing with your hair?
Could you speak more about I guess maybe not what motivated your transition to practicing root cause practice, but what that process was like, because it sounds like it would be a kind of steep transition, you know, like, does it mean more training for me? Does it mean like stopping my current practice, and where's my income now? And does it mean I have to seek out my own network? Because I'm just thinking about how to good news with other physicians?
Sure, yeah.
Yeah.
So I'll kind of touch on your first question as well. The reason that I was blessed to come across Napro Technology was my marriage was on the brink of divorce and God healed it. And in the midst of that, out of complete gratitude for God saving the lives of my children and my husband and myself, I needed to do something that was completely outside of the box to pay him back. And so I decided to go and pray outside of an abortion center because I had read Abby Johnson's Unplanned, and I heard that people do this in a way that's loving and kind and compassionate, whereas I had never experienced that or heard of that in the past. And so the first day that I showed up outside of this abortion center, I encountered a beautiful man who absolutely changed my life by giving me this book about Napro Technology. It's called the Napro Technology Revolution, I believe. It's available on Amazon. Has women running on the cover. But when I sat down with this book, it was a book that was written for lay people, but there was a little blurb for doctors at the bottom of each page. And he talked about two things that just really struck me: ovarian cysts and postpartum depression. And he talked about many, many other things in the book, but those two in particular really, when I read them, I was shocked because I had always been taught that if you have ovarian cysts, the only way to address them is to either put someone on contraceptives or to go in and surgically address the ovarian cyst. With postpartum depression, I was always taught that your only option is to put that person on an antidepressant medication. And in the book, he talked about the use of a progesterone shot, that when somebody has a painful ovarian cyst, you can give them a progesterone shot, and within 24 hours, if it's a benign cyst, it will resolve. The pain will be gone. And I was like, oh my gosh, that could have saved how many patients from going for surgery? And then with the postpartum depression, same thing. A progesterone shot, and within 24 hours, every symptom is resolved. And I was like, what the heck? How is this even possible? And so those two things were enough for me to be like, I need to learn more about this. If I can learn how to practice medicine in this way, at that point in my life, because God had done what he had done for me, all I wanted to do was to live my life in accordance with him. Because when I was in the depths of darkness and I had this huge hole in my soul, he filled it so completely that I was like, I don't care what I lose, but I can't lose you. And when I realized that, yes, I was, a Catholic and I wanted to go to church and everything else, but my job on a daily basis was writing these prescriptions of medications that I personally had never used myself, but I was feeding them to all of these patients, and it completely did not resonate with me at all. And so when I realized, I always knew that they were the Catholic Church was against their use, but in my mind I was like, no, but they've made exceptions in the case of medical problems, so I'm okay, right? But what I didn't realize was, why is it that the Catholic Church is against contraceptives? Number one, it puts a barrier between husband and wife. It suppresses your fertility. You're basically saying, yes, I choose the physical act, but I'm not willing to be open and respectful to your fertility. Number two, the mechanism of action behind every hormonal contraceptive is that of an abortifacient, meaning that every single hormonal contraceptive, the base mechanism of action is to make the uterine lining inhospitable. Yes, they all try, well, not all of them, most of them try to suppress ovulation, but that doesn't always work. And so the backup mechanism of every single one is to thin the lining so that when that embryo implants, it can't survive, or to make the lining inhospitable itself, like copper being released into the lining, or hormones being released into the lining to make it so that it's inhospitable. So when I had that moment outside of the abortion center, and I realized, holy smokes, I think I'm a pro-life OBGYN, but I'm actually not, because I'm writing contraceptives, and contraceptives are abortifacients. I'm placing IUDs in people's uteruses, and those are abortifacients. Then I went to the drug cupboard, and for the first time in my life, I opened every box, and I read every mechanism of action. And I was like, yes, abortifacient, yes, abortifacient, yes, abortifacient. And I was like, there's no way, I can't write this anymore. So then I quickly looked to see how can I be trained in this other way of practicing so that I can continue working as a gynecologist, continue addressing all these GYN issues without the use of contraceptives. So that's what led me into this. And so yes, there is training that you can go for to be trained for Napro Technology. You don't have to redo your residency. You don't have to go through, another 4 years of medical school or anything like that. It's basically a year-long self-study program with 2 weeks, separated out by several months of an intensive where you go to Nebraska and then you just learn all of these things. But what I realized was after I was trained as a Napro Technology Medical Consultant, there's more to it, right? So Napro Technology is beautiful. It's what brought me into this kind of medicine. It allowed me to actually understand how to evaluate a hormonal cycle, what to look for in normal and abnormal bleeding patterns. But what I realized is even Napro Technology is not truly root cause medicine. So you have to take it one step deeper and look at gut health, and look at what you're putting in the body, and look at vitamins, and look at heavy metal toxicity. And so for me, I always believe if you're not learning, you're dying. I'm a forever learner. And for me, it's not a burden. It's not an issue. As far as I'm concerned, every day I'm seeking, I'm who is doing something different? Who is doing something new? How can I learn about that? And God will just drop different conversations around me, and different things will come across my field of view, and I'll know, okay, that's what I need to learn about next. And it just happens. So there are so many people who are practicing in this way and because we're kind of a persecuted group, there's a definite camaraderie. So if somebody wants to step outside of, traditional allopathic medicine, there's a million people who would love to be yeah, come alongside and I'll tell you everything that I know. I would never, if somebody was hey, I want to learn about holistic GYN, I would never be oh, you're going to be my competition. I'm not going to tell you anything. It's never like that. So I would say if there's ever a physician, I think the best gift you could ever give your gynecologist is that book about the Napro Technology revolution, especially if they're a Christian physician or a Catholic physician, because I didn't know what I didn't know. And I would have just kept on along that pathway doing the exact same thing for years probably, and I wouldn't have known any different. But I am so grateful because now every patient that I have the opportunity to touch, we spend so much time because I own my office and I can choose how much time I spend with my patients. So rather than the 5 minutes that was allotted by the insurance company, I can spend 20 minutes with a patient. I can spend 40 minutes if I need to. And we can have a true conversation about what's really bothering them. We can have a true conversation about their relationship. So often in the office, we end up talking about Eucharistic miracles. It's a beautiful, there's never a day that I go to the office that something miraculous like that doesn't happen. But especially if it's somebody who is interested in learning about natural health, the potential is always there to create their own business model, to do whatever they would like, to structure it in a way that works with their family. And if you don't prioritize money over peace and happiness and joy and the ability to make a path to heaven, then there's an endless amount of possibilities. So totally worthwhile. Yeah. Any other questions? Okay, I think I've exhausted you guys.
Thank you, Dr. Ruberu, and especially for encouraging that faithfulness and trust in God, and especially conveying this in a way that really shows that there are options and that there is hope. And I just want to invite all of you, each month we bring in a different speaker, and over the course of this academic year, we've brought in a nun, a cardinal, theologians and historians, people to speak on literature and now in medicine. And then next month on April 12th, we have something special. Pope St. John Paul II's play, The Jeweler's Shop, which is a meditation on marriage and love, will be performed right on campus. And so we're excited for that. And then also on April 28th, we have Marianne Glendon, the former U.S. ambassador to the Holy See and Harvard Law professor, who will be speaking with one of our professors in politics about human rights. So we have these to look forward to as well, and these are open to the public. Thank you.
Thanks so much, Father.